The second speaker, Dr. Hanada, is a professor of emergency, disaster, and general medicine in Hirosaki University. Okay, the topic of this talk is the radiation emergency medicine Japanese system experience in Hirosaki University Hospital and the RISE training course. Would you talk?
Professor Hanada is the leading professor of the radiation injury in Hirosaki. I think it's the Medical Center. Yeah. So he has many experience in this kind of radiation injury. So you were talking about the radiation emergency medicine Japan system. Also his experience in Hirosaki University Hospital. And also Taiwan and we developed a training course we call it RISE. So he will also introduce this training course. So let's welcome Professor Hanada.
Thank you for giving me the opportunity to have this lecture. And also, I'd like to introduce the RISE training course. In this course, contributes a lot of young physicians of this hospital. We discussed 2 days free and complete make some one model course. And already Dr. Hirohashi shows the history and the system and the problem of our system. I also prepared my my presentation. Maybe I will skip the same part. The Hirosaki is here. The Fukushima here. Hiroshima maybe here. Okay. He shows a lot of miserable and burning and a lot of people's photograph. I found this page. You can anytime access to this page to see the any photo recorded during the just after the Hiroshima disaster. Okay, not the disaster, Hiroshima atomic bomb attack. Okay, please. And these images maybe come from he said, the combined injury. This slides, no. This slide shows that Japanese Ministry of Health, Labor and Welfare shows the power of atomic bomb, 50% blast, heart rate 35%, and radiation 50%. But image of Japanese people, all of them from radiation. Okay. So, maybe this comes from the heat rates, or maybe mainly, but still he will be if he lived a little bit, he will may show the degrees of the white blood cells, maybe shows some symptoms of radiation, acute radiation syndrome. But for the Japanese people, image of radiation. So this is not atomic bomb, almost equally the radiation. So the compulsory education in Japan did not cover any radiation-related content from 1970 to 11. It's not just after that. Fukushima power plant accident. That's a big problem. Dr. Hirohashi said that education is important. He's also started to educating every citizens and small children. But this is the fact. Government didn't did. At one example, Ikata nuclear power plant we have here, located in the Sadamisaki Peninsula. We have a lot of power plants in the peninsula. She says there's some problem to evacuate from this part of location. When the injection lawsuit against the Ikata nuclear power plant here, lawsuit filed against the government. They lawsuit. So the government have to explain the power plant is safe. But the logic was that nuclear accident would never occur, and therefore nuclear power plants were safe. It's correct. But this is the government's explanation to make the power plant. So in Japan, they could not prepare the accident. He shows a big slide of the critically accident in 1999 in Tokai village. Until this, we have nothing because the nuclear power plant is safe. Okay. After then, he showed the primary radiation medical institute, secondary institute, and the tertiary. For the east part, Hiroshima University. West part for the Hiroshima University, and east part for the QST. But he shows that these primary hospitals just around the Fukushima Daiichi plant, Fukushima first nuclear power plant cannot work as an institute for the radiation medicine. These are the first primary hospitals when the Fukushima plant accident happened. But they have to evacuate. This is the government order in the acute phase. Primarily the small area, but after the accident, the evacuation area has expanded. And how do you think about this sheltering were ordered for the 30 kilometers? He said about the problem of this primary hospital. But how about, do you think about the sheltering? If you ordered the sheltering in the case of a nuclear power plant accident, can you keep sheltering for weeks or 2 weeks? Are you going, do you want to, maybe you want to go evacuation, I think. It's a order, but now, Dr. Hirohashi shows a system of the evacuating and the system of preventing the exposure for the student. I will show the same slide as later. But this evacuation itself causes a lot of problem. But this sheltering maybe another problem. Okay. What the Hirosaki University did, Hiroshima was a tertiary center, so he did a lot of things. But Hirosaki is a following center. We just started radiation emergency medicine just before the Fukushima accident. Our emergency center started 2010. The accident happened 2011. Okay, but still, we already prepared at that time. Why? The president of our university said that we need to prepare the nuclear power plant accident or something, because my prefecture have a lot of radiation related institute, 2 nuclear power plant and the recycling center 1, and we now have the storage for the used nuclear power plant fuel. So 3 kind and 4 institute in only 1 Shimokita Peninsula in Aomori Prefecture. So the president of our university ordered our government give us the money to make the ER to prepare the accident. It takes 10 years to make our ER. But we started already the 2010. So we can do something for the Fukushima. Emergency management headquarters invited our former professor and Asari and Tokonami went to the Fukushima and worked at the headquarters, and Tokonami and the co-workers surveyed students in some areas. They get a lot of data from this area. This is the photo of his Tokonami, and this photo I took this photography. The environment those of the Fukushima city, and the surface of the asphalt shows a count of over than 60,000. 60,000. Okay, what this means? The environmental dose of Chernobyl is 7 microsievert. At November 2011, when I went to there, this is the very early phase of Fukushima city. Okay. Tokonami measured a lot of dosage and published the paper for thyroid doses. Only the 2.2 millisievert and 3.5 millisievert for children and adults. But only 46 out of 63 residents thyroid doses they measured. Well, this is very important data. And this is a snapshot of the TV program. This TV program, Dr. Hirohashi is in here. Okay. This is a NHK TV program. Who will save the people in this area? I showed all the same picture from this as Hirohashi. I said the same thing. The lack of evacuation plan delays selecting evacuation sites and the communication breakdown. This is maybe the important thing. We could not use the cellular phone at that time in the seashore area of Fukushima. Contribute to the unfortunate outcome. Dr. Tanigawa, former professor of the Hiroshima, said that some patient, I found some patient is under the seat. Nobody cared this evacuation. So I put the picture around here. This is very important photograph. You took the. And Dr. Hiroshi went to the Fukushima as a DMAT, not for the radiation medicine, but he has to do the radiation medicine, and he did. It's very important thing, okay? He said already here. But these patients are coming from here. This should be the primary hospital. But all nurses and other personnel in the hospital already evacuated. Only the president of the hospital and a lot of patients in the there is a lot of only the patient and the doctor. President, only one doctor are left in this hospital. So these kind of things happen without any evacuation plan. And Dr. Nishizaki, he was a resident at that time, followed Professor Asari, and he was instructed to observe these patients. This is the communication center near to the Fukushima city. Almost the same photograph from the Hirohashi. These kind of things happen not only one site. And 3 patients died overnight at that system. And our ER emergency center have the special treating room for the radiation patient and the underground. So we surveyed people from Fukushima. There's like these babies and the mothers. This is the sample of the patient measurement. Because Aomori Prefecture is a little bit far from the Fukushima, so we don't have so many people evacuating people. But we maybe did 20 or 30 patient residents from the Fukushima. And this is the next temporary entry project to the restricted area. Because the residents in the restricted area evacuate only a small package and only their car, so they have to do something to pick up their own house. This project was provided by the prefecture and the national government. The sheltered hotel, the people evacuated come from the sheltered hotel to the relay station. This is the relay station. Then went to their own house, pick something from the house, then return to here and return to the evacuated hotels. And we have to check their health condition, because these projects started the rest of May and continued to the August. The temperature is very high. Residents have to wear some PPE. So we have to check up the heat shock mainly. Okay. And we send we send 12 teams from our university, totally 202 people. And Dr. Hirohashi also showed the ER room in the restricted area already. It's outside of the restricted area now. But the acute phase, we have the here ER for the worker who working in the radiation controlled areas. We said this 5-6 ER because 5-6 power plant is not destroyed. Only first to the fourth are destroyed, and apart from here. So we set the ER initially here. Dr. Taniga made a lot of equipment here. And also this clinic was open, the J Village. It's originally the soccer space. But we, at the acute phase of the power plant accident, this was set as a transit point from unrestricted area to plant. We treat some patient, a lot of patients from the power plant because the hospital did not accept whenever patient and I'm sorry. Hospital around this area cannot accept unless the patient cleaned. With contamination, they couldn't accept. So we have to treat here almost all patients. And I and the co-workers from Hirosaki and from a lot of all over Japan, including the Dr. Hirohashi, went to these ER and this maybe the 100 doctors more went to this from the all over Japan. But Hirosaki University sent a lot of doctors and nurses here. This is a TB program in NHK, recent TB program. This focused on the people who was working very near to the plant. The CISOs, more than 5,000 people are working still now. So we need emergency room in this area. We must set the ER or some hospital. Now the hospital around the power plant is accepting these people, but acute phase, they didn't. So we didn't have any student who died from acute radiation injury or radiation syndrome, okay? But evacuation makes a lot of problem. From hospital, also nursing facilities. Non-specific evacuation plan, evacuation destination was planned before the accident. No medical plan, medical assistance was provided this phase. And the Hirosaki University dispatched many paths to this project. And then he said that the emergency system changed to the subject. Already was workers on site before the Fukushima Daiichi nuclear power plant disaster, then go to the change the subjects outside the citizen residence. So that we call the name radiation emergency medicine to radiation disaster medicine. Maybe that the government started to use this word. And that's Japanese documentation to describe radiation emergency medical system. And this is a newest version. He said EAL and OIL already. And explained this system. He said that this already the state of alarm, we need to prepare the evacuation. But evacuation still the main purpose of the radiation protection. And we said the OIL also, if the environmental dose exceeds 500 microsievert, area identification within hours and evacuation for the UPZ. But until 20 microsievert, if the dose reach to 20, these people must be evacuated within a week. It means you should be hide or stay in your home for 1 week at least. Then evacuation. And we have the government pays money to make the negative pressure house for the nursing facility. They are providing money to make this system, but the negative pressure shifts doesn't have an air conditioning system. If the summer phase, only they do not have the air conditioning, so maybe the heat shock can occur. And in the winter, we will be very cold, okay? Sheltering is a lot of problem, I think. If the environment doesn't reach to the 20, if your environment is said as 10, what is ordered? Are you going to evacuate? Maybe. But in this system, nothing was described about the low, less than the 20. And we drilled last year, and in Aomori Prefecture, the student evacuation from the near to power plant. The people was stopped by the policemen. Where I come from? I come from this town, this village. Your village is not so far from the, not less than 5 kilometers from the power plant. You should be stay, policeman said. But police, if you want, the student want to go away, the police cannot stop the student. It's a controversial point in our system, okay? This shows already the Dr. Hirohashi. And this also but this has another problem. We cover this only the prefecture which have the nuclear power plant. How about this white area? Because the budget provided for the education of only for these prefectures, So if you want to teach these areas, you have to pay by yourself. How about Dr. Hirohashi is doing this by yourself? Start to do. But for these patients, and one problem is people in even in medical staff in these white area did not interested in radiation and emergency. Okay, it's a big problem. But we have to do something. This is new, and we have the only 100 team here. Maybe the DMAT itself for more than 4,000. How you think about this? I evaluated this number is sufficient for the evacuation or something. And in Aomori Prefecture, we have the only small people around the small residents around the power plant. So the 100 team can treat all of them. But other power plant within the UPZ, more than million people living. If all of the people in the UPZ need to evacuate, even in 5 PAZ, 100 team cannot handle, I think. This is he already showed a lot of power plant in this. Japanese has and Korea has and Taiwan already. I can't see it here, but, and a lot of power plant in the seashore of the China, main China. So I am thinking of this. We should collaborate when something happens, because I said already the only 100. Oh, sorry, I spent a lot. So we started make the life training program to. I'm sorry. To combine these 3 countries. This RICE program has common medical response algorithms and created a training plan based on it. This is based on we need to collaborate with Japan, South Korea, and Taiwan. And this course with core emphasis on prioritizing medical procedure, not the contamination or decontamination. We are focused mainly on the medical procedure. And the algorithm overview is resuscitation, detection, decontamination, and colored red, yellow, green. This is a basic schematic flow chart. We do the firstly the primary survey, and if they need the resuscitation, go resuscitation. And after resuscitation, we say the resuscitation okay. Then go to detection. Then if you detected something, detected the radiation activity, we go to decontamination. Then we set the safety manager as the same as hazmat in this Taiwan. The safety manager manages PPE and this area management. That's resuscitation, detection zone, and here the decontamination. Then we set the red and yellow and green color here. Then the sample room arrangement here. The point is patient come here, need to go to the resuscitation zone, then go to the contamination zone. Usually we had only one room for resuscitation, decontamination, detection, decontamination, only the same room. But we are providing this as the patient goes through this way. Then decontaminate. This is a hot zone. If the patient decontaminated, here's a warm zone. The second survey was cleared. Go to the green zone. Cold zone. Then we should survey, think about ARS system. Is there ARS or not? This is the sample or course agenda. For the first section, the lecture section for 2 hours, and the skill section for 2 hours, almost 2 hours. Basic concept, principle of protection, biodosimetry, lice training course algorithm. So then start for the skill section, we do the start triage, PPE wearing, detection, decontamination, and ARS. And after the lunch, we do the exercise and drills. Maybe the 30.5 hours. This is a sample presentation for a lecture for the first part 1. General concept of managing radiation emergencies. For this, what is radiation emergency medicine? Medical management, radiation management, and dose management consists of these. We make these PowerPoint data all over here already, mainly the work of this young physician from this hospital. And this is the stepwise training scenarios. This upper part shows what scenario is setting, and the key lecture point here. Stepwise scenario shows that this is stable but uncontaminated to the contaminated and stable. Here's a point of we have to show, and the learner must learn this point. The concept is like ACLS course. We have we prepare the stepwise scenario and case-based teaching. Only one point focus on the one scenario. Then goes to the combined scenario. So the rice training program, the rice is the same as we are eating rice. That's a very important point, I think. So Korea, Japan, and Taiwan also eating rice. Rice is very easy to understand. So we set the rice radiation injury care impairment course. The radiation detection decontamination were color coded as red, yellow, and green to make it clear. Responding staff, what was currently being performed. Emphasize the medical treatment makes priority. A system for moving patient within the hot zone. This is here, moving the patient. As may facilitate handling more casualties. Green triaged patient, that's triaged. Green triaged patient move independently. Yellow and red triaged patient move on stretcher in the same room. A safety manager was assigned to prevent contamination spread and manage safety, including PPE, donning, doffing, and zoning. Scenario training focused on key points like case-based learning and employs step-by-step learning. And this course can be attached to the white area in Japan, I think. Maybe the very easy course, we are thinking about one-day course. So in Japan, we need the stepwise training to make to have some certification. But the good point of this course is only one day to do, and easy to, I think. We have to do the pilot course to evaluate the system will go well or not. Thank you very much.
那我们请台北荣总合一部彭南进主任以及林口长庚医院急诊部的林志全教授来为花田教授颁发合影跟感谢状。OK， 帮我们热烈的掌声，感谢弘前大学急诊的花田教授。